Hello and welcome to AT Talks, the Assistive Technology podcast. I'm Tammy Ulyate.
And I'm Kate Brimblecombe, and we're excited to welcome you to this podcast. To give you some context, Tammy and I are recent occupational therapy graduates from Australia.
During our first year at the University on the Sunshine Coast, we worked alongside Australia's peak body for assistive technology, ARATA, to facilitate the use of podcasts as an effective way to share important knowledge. The purpose of this podcast is knowledge translation, so sharing important research findings with a wide audience in an easy to digest format. This allows you to listen on the go from your mobile device or computer. We will be summarising the results of a series of studies into access to assistive technology during the first COVID-19 pandemic. The World Health Organization commissioned Monash University and the Centre of Inclusive Policy to answer two questions. 1. What are the experiences of AT users and providers during the COVID-19 pandemic in relation to AT access and service delivery? And question 2. What are the implications of the COVID-19 pandemic for AT system strengthenings?
We're excited today to introduce our podcast guests, who were investigators on this exciting piece of research. Dr. Daniel Mont, the CEO of the Centre for Inclusive Policy in the United States, and Dr. Natasha Layton, an occupational therapist and senior research fellow with Rehabilitation Ageing Independent Living Research Centre in Melbourne, Australia.
Hi Dan, hi Natasha, thank you for joining us virtually today.
Hello, hi everybody.
Hello, and thank you for having us.
So good to have you. Let us begin by setting the scene about the basics of assistive technology. Dan, can you please start by explaining to us, how does the World Health Organization define assistive technology and assistive products, and where does assistive technology services fit in?
Well, starting with the products, an assistive product is any product, digital or physical, that's used by someone to improve their functioning or their interaction with their environment, to do the things they need to do during the course of the day. These are things that can act as assistive products. They're sometimes specifically designed for that purpose, like a prosthesis or a wheelchair. But there are other mainstream products that any person might use, such as an app that sends reminders, or a magnifying glass, or even a handrail that could be considered an assistive product. But that's just the products themselves. Because when we talk about assistive technology, we're referring to broader systems, services and products that work together to ensure that people receive the product they need, but they also receive it in a safe manner by an appropriately trained professional.
Yeah, so it's not just a basic off-the-shelf type thing. Natasha, is there anything that you wish to add to this description?
Yes, the sorts of products we're talking about include, and it's very broad, include assistive products for mobility, as Dan mentioned, such as prosthetic limbs, wheelchairs or adapted bicycles. Assistive products for hearing can include hearing aids, closed captions. Assistive products really helpful with vision, eyeglasses, braille writing equipment, white canes, screen reading software, tactile markers. Self-care products can include incontinence and bathing supports, communication supports like adapted computers and communication boards. And those are all examples from the research we're about to tell you about. And it takes a team to fit products to people. As you can imagine, people who need to use assistive technology are often experts in knowing about their own needs and capabilities, but there's so much diversity in products and sometimes complexity in the products that are available that different assistive technology professionals or even community-based rehab workers will have skills in working out exactly which product will work in each individual environment and for each individual person.
We're hearing that assistive technology is a combination of products and wraparound services. Are there any other factors involved in accessing good AT, and how are we going to meet the needs for good AT?
Well, that's a very important question. And unfortunately, a lot of research shows that right now in the world, fewer than 10% of all the people who need assistive technology have access to it, which can have profound implications on their quality of life. The WHO has come up with a simple way to describe the sort of system components that are needed for the proper delivery of assistive technology. And it's really easy to remember because all 5 of those components start with the letter P. So we call it the 5 Ps. The first one is policy. So there needs to be a policy in place that stipulates that AT is part of the health coverage provided by countries' health systems. The second is personnel. So you have to have properly trained personnel in order to provide the AT safely and appropriately. And the third P then is provision, which deals with the systems whereby those personnel can provide the products to the people who need them. And finally, we have the products themselves, which are not always easy to source. They're often expensive. Now, if you add those all up, that's only 4 Ps. So you think, what's the 5th one? And that's the people who use the assistive technology, right? They're the people at the center of the model, right? Because those are the people who we're trying to provide the assistive technology to, so they can enjoy their full rights of participation, like all people have the right.
Absolutely, because that's what we do it for. It's the person-centered. So we know assistive technology enables people to function and participate. Also, that access to assistive technology is critical to achieve the sustainable development goals, and that people have a human right to assistive technology according to the United Nations Convention on the Rights of Persons with Disabilities. You've told us pre-COVID that globally only 10% of people had access to the assistive technology they need. What has happened during and post-COVID-19, Tash?
That's right. We just didn't know. So the WHO commissioned Monash University in Australia and the Centre for Inclusive Policy in the United States to find out, and we ran a global study across 6 WHO world regions. So that included the Americas, the Western Pacific, Southeast Asian region, the African region, Middle East and European regions. And we wanted to find out about life for people who use assistive technology right through from children through to older people.
Yeah, and we also asked AT service providers, because remember, we're talking about a system, right? And the service providers are obviously an important component of that system. So we wanted to find out how they were managing and adapting to the situation.
Yeah, would you be able to expand, Natasha, about the global study?
I will mention first some other parameters around it. Our study ran from October 2020 to March 2021 during one of the first waves of COVID-19.
Yeah.
And it was important, I think, that our study employed regional researchers who had lived experience of assistive technology use or were connected to the disability and ageing communities in some way. And having regional researchers meant that the interviews that were conducted, we did surveys and other methods too, were conducted by someone from their own region. So yes, the global study, we use these interviews and surveys to directly ask AT users and their families questions about life before and during COVID-19. So we had some sort of comparator. And we were saying, what assistive products and services do you use? What's daily life like with those supports? Did you need any other supports to live your daily life? And did you have any unmet needs? And what barriers are present to living life or getting your AT? We then said, during COVID-19, what is different about how you participate and what has most impacted on your life and on the services that were required to get your AT up and running? And we were particularly interested to hear how people were addressing those challenges.
Well, yeah, I mean, apart, as Natasha said, talking with the people, the AT users themselves, we thought it was also very important to include the AT providers, right? Because they're part of that system. And not surprisingly, virtually all of them said that their services were forced to close completely at some stage. And they really faced challenges in knowing how to reopen and how to keep reaching their clients. So they had to change those models on the fly with virtual services, contactless pickup, right? So they would go and go to the person's house, and the assisted product would be on the porch. They would go and take it away and bring it back, and then they would also have to at times teach the assistive technology users how to repair their own products. And in order to do that, they had to set up different systems of communication, whether through smartphones that allowed for telehealth, various hotlines and billboards and various ways to try to communicate with those AT users. But they really felt it was a very big challenge because they were not used to having to take the infection control measures, using PPE and thinking about how to provide those services in a way that was safe during times of pandemic. And so that was a very big challenge. And that they were not prepared for.
Still just finalising our context here, we had 110 assistive technology users and their families from 32 countries. And Dan's there discussing some of the results that came from the 37 assistive technology providers that responded as well. And Kate and Tammy, it's probably interesting to just start putting a context around some of those solutions we've just heard or problems that were uncovered by talking about what we found about COVID and pandemic restrictions, because people didn't necessarily have COVID, but they were living in an environment in which COVID had changed many of the settings of personnel, products, policy, all of those ecosystem things that need to work for AT users to get on and live their lives. And public health, we found, even though pandemic restrictions meant that all people were equally excluded, exclusion for AT users was worse. Public health measures created all sorts of unintended consequences for users. Social distancing meant it was very difficult to have your personal support worker assist you. Self-isolation changed how children were learning to socialise and communicate. Lockdown, of course, and meant service closure, and people couldn't get out and about. There was fear and risks of contracting COVID-19 and the people around contracting it. Difficulty accessing new equipment like masks that was seen as being necessary to be safe. We also asked people were telling us that communities in some instances were less inclusive, and that might have been around fear. And a lack of information about either COVID or then how to access AT and related services during COVID. And also this sense of the system was pretty burdened, and how would you get your needs met?
Absolutely, yeah.
In terms of the providers, well, I was already mentioning before about their lack of preparedness in terms of dealing with the global health situation, but there were other challenges too. I mean, one is the supply chain. Supply chains were disrupted everywhere, and in a lot of the countries that we were studying, those assistive technologies have to be imported. And so when those supply chains got messed up, it really caused problems in actually getting their hands on the products. Then there was the delivery, like I was talking about. And there was also the notion that the governments saw AT services as non-essential health services, because they're thinking of it in a very medical model. Like, what does the person need to sort of live? They're not thinking of it in terms of a social model of disability. A prosthetic, a wheelchair, a hearing aid, these are not just things to live. These are things to be able to fully participate in society, do the things you need to do. And I think governments need to start thinking about assistive technology, not as sort of medical devices, but as devices that allow for that participation.
Yeah. What are the recommendations after that that you'd sort of come up with?
We've got this beautiful list, haven't we, of recommendations and subsets. And what I think the best way to communicate that might be to work through our list. And Dan, I'll invite you to add examples as we go to illustrate those. And then we can tell you where these recommendations have been documented so people can look further. But Dan, please start us off.
Oh, well, I think one of the most important recommendations, that it's important to consult with people with disabilities. And especially AT users and their families and representative bodies, because they're the ones with the lived experience, right? They're the ones who understand the importance of AT and how it's delivered, and keeping them out of the conversation is just going to undermine its effectiveness. And we also have to prepare. We have to prepare and understand how to deal with the health responses that many people who have AT have. We have to improve the communication formats to ensure public messages are accessible. There was one example from India where the government had put out all these videos about how to wash your hands and how to sanitize things, but they were videos, and the people who couldn't see just did not have access to it. And it took the disabled people organizations themselves to come in and fill that gap. and create forms of communication to describe what to do to people who couldn't see. And it's important that we really recognize information communication technologies, smartphones, for example, and which time and time again people reported as being lifesavers for the people who had them. Of course, not all people had them, and the people who had them, they have to be accessible, right?
That's right. We were seeing all sorts of examples, whether it was from sort of sustaining people against really depression and isolation through that contact. We had examples where assistive technology users themselves were taking it upon themselves to ring and check in with other service users who they knew were quite isolated. And we had examples where some of the service providers were using contactless delivery, as Dan said before, using a rickshaw to deliver the prosthetic repair equipment to a village, to someone's front door, and then on the phone explaining how to self-maintain that equipment. So it was very empowering, and it was just pretty essential. And I think another example that stood out to me was people being told to sneeze or cough into their elbow, and yet if you are someone with a vision impairment, then you need to hold your sighted guide's elbow. So just not thinking through. And I guess those examples we've given have all fit under recommendation 1, which is make pandemic public health responses inclusive of people who use AT. And I think I'll invite you now, Dan, to the second of 3 overarching recommendations, is recognise AT as essential health products and services during a pandemic or a health emergency. And I'll just invite you to talk through our half a dozen sub-points there.
Sure. Well, first is that, as I was saying, AT services have to be seen as essential. They need to be kept open, safe, and accessible. They need to be provided in the first place. As I said, 90% of the people aren't having them, don't have access to them, and there has to be preparation for disasters and future pandemics, or whether they're earthquakes or whatever that is, to secure those supply chains, and to provide the personnel who deliver AT services with the training they need on infection control. And to establish those telehealth and other methods that can enable services to continue when there is a pandemic or a response that requires that sort of isolation and social distancing.
That's right. And we, particularly in the data from Australia and the UK, I noticed for some people with disabilities, particularly in the chronic illness community, who were spending a lot of time in their houses or in their beds, in a way, life actually improved slightly because telehealth suddenly became available in a way it wasn't before. And we had concerts being streamed. You could watch puppies grow up at the puppy farm through a webcast. There was a shared participation in these remote activities that were asynchronous, offline, could be done if you have chronic illness or fatigue issues. So we were quite conscious, and people were telling us about these tiny accommodations that made life really quite different, and we wouldn't want to lose post-pandemic, I guess.
And the key thing that comes out of that is that there's a great variety and variance among the population of people who AT users. We can't think of them as a sort of homogeneous mass, right? There were certain things, like Natasha was saying, where people actually improved their situation, right? Because more things were done virtually. So people who had physical mobility limitations are actually able to have, if they had access to the internet, had greater access to interacting with people. But people with mental health conditions and feelings of isolation, it was really, really bad for them. So we have to think of the people with different types of functional needs, different types of AT users, and understand them in the context they're living with. And that's why it's so important to include them in the design, implementation, evaluation of all of these programs, to make sure we get all those perspectives.
That's right. And the advice that people were giving us, the agile workarounds, the creative solutions, and the sort of care for others in the community was was pretty profound, and the solutions lie there, I think, if we were to just listen to the ingredients of inclusion when these sort of pandemics are upon us. And the third and final broad strategy or recommendation, strengthening AT services to improve preparedness for future pandemic responses. Dan, would you like to walk us through these couple?
Sure. Well, a key one is to integrate those services into the healthcare systems. I mean, right now, in most places in the world, assistive technology is not integrated with healthcare systems, not delivered through healthcare, which is why countries that even have national health insurance aren't paying for assistive technology, because it's seen as a separate thing. We really need to bring those things together. And of course, we have to address the access barriers to getting that assistive technology. Of course, there's the financial barriers, but there's also physical and informational barriers, and those need to be addressed. And we have to also equip a broader range of health personnel. So in times of crisis, we're not, we have more people who can help maintain and service and fit and deliver those assistive technologies. And we have to include assistive technology response in our disaster risk management plan.
Yeah, that was very insightful, and really looking forward to seeing how this will be implemented in the future. In conclusion, where does this leave us now? And are you able to just restate the learnings just in a summary?
Thanks. Yeah, it's we felt it was very important to publish these findings in article form. So we actually have 3 articles that came out of this research, which are available in the academic literature. So they're published in peer-reviewed journals, but they're freely available and can be downloaded. And we're doing a lot of work, such as with the podcast, to get these messages out and really to try and hope that the governments take them up and civil society implement some of these recommendations. So by publishing these 3 articles, we hope we've let the voice of AT users, families and providers really put some evidence around what life is like under pandemic conditions and point to ways to improve and strengthen systems. So you can freely download these articles from the International Journal of Environmental Research and Public Health. And the articles are called Access to Assistive Technology During the COVID-19 Pandemic, Voices of Users and Families. The second article is Assistive Technology Provider Experiences During this COVID-19 Pandemic. And the third article is Assistive Technology and Support Services During the COVID-19 Pandemic, the Roles of Government and Civil Society in Fulfilling the Social Contract.
And the World Health Organization has a major program trying to improve the delivery of assistive technology, increase access to people. They're working across all those 5 Ps I mentioned before: the policy, personnel, provision, products, and of course people. And they recently published, they're publishing a whole range of tools and guidance on assistive technology that people can access through their website.
Wonderful. Yeah. Thank you so much for sharing these findings today, Daniel and Natasha. And hopefully this will invite some improvements around the world in assistive technology. Thank you for listening to the podcast, wherever you're listening from.
And a few key pointers if you'd like more information or to join the global access to assistive technology community, you can Google WHO Gate or visit mednet-communities.net/gate.
We'd also like to remind listeners that the WHO UNICEF Global Report on Assistive Technology will be released on World Assistive Technology Day, the 14th of April in 2022.
It's lovely to be able to share our learnings, and we would direct people to any of those links to get further information or contact us. Thank you for hosting us.
You're welcome.
Yes, thank you very much. And I just want to say that it was this research was a great experience, really being able to draw on those regional researchers and the experts at Monash and WHO. It was a very collaborative effort, and I think the studies show that. And thank you very much for giving us the opportunity to talk about it.
Thank you.
Bye.
Bye.